Okay, Jen, the EasyIO is in. Epi is going to be 2.7 milliliters. We need to keep an eye on the clock. We need to switch compressors every 2 minutes on the even numbers. Medication will be on the odd numbers.
We got 1 more minute till we switch compressors.
Great, I'll come up and switch after that. Okay, in 15 seconds, we're gonna charge the defibrillator. Ma'am, my name is Greg, okay, and this is Jen. We're gonna do everything we can for her, okay? We're gonna do everything here, just like they would do in the emergency room. Her best chance of survival is working her here, okay?
Okay. Greg, we're at 15 seconds.
Great, charging. Okay, I'm clear, you're clear, we're all clear. Shocking.
I like the way these medics work. It's obvious they've done this before and that they've rehearsed their moves extensively. But did anyone notice that the medic automatically knew the patient's epinephrine dose and defibrillation joule setting, even though it's weight-based? The answer is they're cheating. And if you're not cheating at pediatric resuscitation, you're not trying hard enough. In Dr. Atul Gawande's checklist manifesto, he relates the story of an unflyable airplane. A number of test flight crashes of the Boeing bomber prototype occurred, and there were numerous injuries and deaths. The plane was deemed by test pilots as too much airplane for one man to fly, until the pre-flight checklist was conceived. That checklist allowed the plane to be flown nearly 2 million miles in testing without a single incident, and the prototype went on to become the B-17 bomber, playing a vital role in the Allied victory in World War II. Since then, we've recognized the value of reference tools and procedure checklists in performing complex tasks. They're used extensively, not only by airlines, but by other industries as well. And they're even a key component in performing surgical procedures. When it comes to performing complex tasks like pediatric resuscitation, it is far better to stand on the rock of a written reference tool rather than the quicksands of memory. There is no shame in looking things up. Using a pediatric dosing guide, resuscitation checklist, or sizing chart allows for what's called cognitive offloading, allowing us to focus our decision-making processes on more important things. Unlike adult resuscitation, where medication doses and equipment sizes are relatively uniform and easily memorized, pediatric resuscitation relies on weight-based dosing and sizing. Calculating a child's proper medication dose, the proper ET tube size and depth, and the proper energy settings for cardioversion or defibrillation while simultaneously questioning the parents about arrest events, directing the actions of other rescuers, and engaging in resuscitation problem solving is a tall task for any provider. As the saying goes, if you're doing math problems in the middle of a pediatric code, your priorities are in the wrong place. Hence, pediatric resuscitation guides that do the math for you based upon the child's weight, height, or age are commonly utilized, and the Broslow tape is among the more commonly used tools. Length-based resuscitation tapes give equipment sizes, medication doses, and defibrillation cardioversion settings based upon the average weight of a child of that height, or length, since we're typically using them when the child is supine. They are fairly accurate for a child of average weight for his height, but they require you to arrive at the patient's side and measure them before you know what size equipment or dose of medication to use. Age-based resuscitation guides like the hand-TEVI system provide equipment sizing and medication dosing for an average-sized child for that age. Age-based systems do have an advantage over length-based systems in that they allow the crews to pre-plan their actions based upon the age of the child from dispatch information before they arrive on scene. Now, while we won't endorse one product or another here, it's important that you use something and all crew members be familiar with its features. the use of a resuscitation checklist and or dosing guide, and good small group communication are key elements of crew resource management, or CRM, and are the foundation of intricately choreographed resuscitation techniques such as pit crew CPR. You see the medics using similar communication techniques and scene choreography on their patient, and they were able to reference their age-based pediatric resuscitation guide before they even arrived on scene. Use a pediatric resuscitation checklist and refer to it throughout the code. As a matter of fact, it's a good idea to adopt a similar approach for any complex medical task for adults as well.